who use marijuana, and many say that marijuana is not addicting. You've heard that before. Is it addicting?
So I hear that every day.
Yeah.
So marijuana on the scale of addictive medications is at the bottom.
Right.
But it is still addictive to some people. But when you compare it to other drugs like heroin and cocaine and even alcohol and alcoholism, it's not near as high as the other ones. But it does have mild addictive potential.
But the medical benefits, and we're learning about new ones now every day, what is it mainly prescribed for? Yeah,
so back in the day, in the 60s, we wanted to be altered, and then in the 70s it's cocaine, in the 80s it's E, in the 90s it's meth, and now it's prescription drugs, and it's weed, and we're constantly an altered society. Sure. And so we think of marijuana as a bad drug, but the reality is there's a lot of really great medicinal properties associated with marijuana. And everything from cancer to nausea to autoimmune to anxiety, there's so many different purposes that medicinal marijuana can be used for. The problem is you've got this murky water of recreational people that want to get high, people that use it for medicinal purposes, and then all of the political
Sure.
infrastructure around the weed industry.
In fact, there is greater acceptance. I mean, you know, more and more people now are more accepting of marijuana use, even recreational marijuana use now. But if you go to any high school, let's be honest, lots of kids are smoking weed now. What's the dangers of kids or our minors smoking marijuana?
So 55% of our country wants to legalize weed. President Obama has said it's equal to alcohol. It's pretty widely accepted. The only place where I think we really need restrictions is with the youth. I'm for legalizing marijuana because of its medicinal purposes. I think it will help a lot of people. But at the same time, I'm against youth use of marijuana, specifically between the ages of about 12 and 19, 12 and 18, because our brains are constantly forming until the age of 25. So if you've got this brain that's still being pieced together, and then you scramble it a little bit with a substance that can have cognitive effects, you can have some problems. They're subtle with weed. It's more anxiety, some sleep issues, you're kind of not very motivated. Yeah. It's those kinds of things.
Does the medical community in this country believe in the medicinal properties of marijuana? Because if I go to a doctor and I tell them what my issues are, I've never heard the suggestion you should try marijuana. I get a list of prescription pills. Yeah. Do you think that will change? Yeah,
you don't see the doctor going, okay, I'm just going to prescribe you some weed.
Right.
Have a good day. You know.
Have a joint.
Yeah, have a joint. No. Just line up.
Is that the pharmaceutical industry or the medical industry?
It's all about the lobbying. Think about the lobbies. We've got the pharmaceutical industry lobbying for their pills. In the weed industry, who do we have lobbying for weed? We have recreational users primarily lobbying for it. Now there's big capital, big companies that are slowly forming behind it. But who's promoting it? I think weed has, medical marijuana, actually has the potential to decrease our prescription drug epidemic in this country, because it does help with anxiety and with sleep and with pain, which are three of the main prescription meds we take.
We could talk about this forever, but you have a special, Reef Nation. It's on YouTube.
It's called Reef Madness.
Reef Madness.
Reef Madness. It's on YouTube. My name's Reef. It's 420.
There you go.
I'm a psychiatrist at work.
So my real name is Sativa. So we could have both gotten into that field.
Yeah, our parents probably hippies know each other. Yeah.
All right, Dr. Reef Karim, thank you so much.
Thank you so much.
Thank you. Thank you for having me.
More fallout from the